Fexofenadine. Fexofenadine is an antihistamine used to relieve allergy symptoms such as watery eyes, runny nose, itching eyes, nose, sneezing hives, and itching. It works by blocking a certain natural substance, histamine, that your body makes during an allergic reaction. How to use Fexofenadine? If you are taking the over-the-counter product to self-treat, read all directions on the product package before taking this medication. If you have any question, consult your pharmacist. If your doctor has prescribed this medication, take it as directly, usually 2 times daily. If you are using the liquid form of this medication, shake the bottle well before each dose and measure the dose carefully using a special measuring device, spoon. Do not use a household spoon because you may not get the correct dose. Take the tablet, capsule, or liquid from the medication with or without food. If you are using the rapidly dissolving tablet, take it on an empty stomach. Allow the rapidly dissolving tablet to dissolve on the tongue and then swallow with or without water. Do not remove the tablet from the blister pack until right before using. If you need the liquid to take this medication, such as when taking the tablet capsule, then take this medication with water. Do not take with fruit juice such as apple, grapefruit or orange, since they may decrease the absorption of this drug. The dosage is based on your age, medical condition and response to treatment. Do not increase your dose or take this medication more often than directed. Do not take antacid contain aluminum and magnesium within 2 hours of taking this medication. These antacid can decrease the absorption of Fexofenadine. Tell your doctor if your condition does not improve or if it worsens. Side effect: cough, fever or stomach upset may occur. If any of these effects last or get worse, tell your doctor or pharmacist promptly. If your doctor has prescribed this medication, remember that your doctor has judged that the benefit to you is greater than the risk of side effect. Many people using this medication do not have serious side effect. A very serious allergic reaction to this drug is rare. However, get medical help right away if you notice any symptoms of the serious allergic reaction, including rash, itching, swelling, especially of the frog tongue, severe dizziness, trouble breathing. This is not a complicated list of possible side effects. If you notice other effect not listed above, contact your doctor or pharmacist. Precaution: before taking Fexofenadine, tell your doctor or pharmacist if you are allergic to it or if you have any other allergic. This product may contain inactive ingredients which can cause allergic reaction or other problems. Talk to your pharmacist for more details. Before using this medication, tell your doctor or pharmacist your medical history, especially of kidney disease. Before having surgery, tell your doctor or dentist about all the product you use, including prescription drug, non-prescription drug and herbal product. Liquid products may contain sugar. The rapidly dissolving tablet may contain aspartame. Caution is advised if you have diabetic phenylketonuria or any other condition that requires you to avoid this substance in your diet. Ask your doctor or pharmacist about using this product safely. During pregnancy, this medication should be used only when clearly needed. Discuss the risk and benefit with your doctor. This medication passed into breast milk. Consult your doctor before breastfeeding. Consult your pharmacist or physician. Interaction. See also how to use section. Drug interaction may change how your medication work or increase your risk for serious side effect. This document does not contain all possible drug interaction. Keep a list of all the product you use, including prescription, non-prescription drug and herbal product, and share it with your doctor and pharmacist. Do not start, stop or change the dosage of any medicine without your doctor's approval. This medication may interfere with certain laboratory tests, including allergic skin testing, possibly causing false test result. Make sure laboratory personnel and all your doctor know you use this drug. Overdose. If someone has overdose and have serious symptoms such as passing out or trouble breathing, call 911. Otherwise, call a poison control center right away. Notes. Keep all regular medical and laboratory appointment. Miss dose. If you miss a dose, take it and soon as you remember. If it is near the time of next dose, skip the missed dose. Take your next dose at the regular time. Do not double the dose to catch up. Storage. Store at room temperature away from light and moisture. Do not store in the bathroom. Different brand of this medication may have different storage need. Check the product package for instruction on how to storage and your brand. Or ask your pharmacist keep all medication away from children and pets. Do not flush medication down the toilet or provide them into a drain unless instruction to do so. Properly discard this product when it is expired or no longer needed. Consult your pharmacist or local waste disposable company.